you tired of experiencing digestive symptoms like loose bowels, constipation, reflux, bloating, excess flatulence, and food reactions? Have you addressed these 5 possible triggers? One of the first areas that we assess as naturopaths is the possibility of food reactions. So food reactions come in many forms. Often people will refer to food allergies when the symptoms that I described before are actually usually a result of a food intolerance or a food sensitivity. How that happens is with the digestive tract, it's like a long tube. And then along the tube, you've got what are called enterocytes. So they're gut lining cells that all link together like a chain. On the ends of those enterocytes, you've got these little hairs. And so those little hairs, they move like this, and they release what we call digestive enzymes. So when you eat food comes into the gut, these digestive enzymes get released by these little hairs, and then the food breaks down into smaller particles in the hope that all your vitamins and minerals pass through to the bloodstream. So that's what you call absorption. In some people, what we see is that these little hairs, they're not as plump or as healthy as they could be, so they're slightly drawn back. When they're slightly drawn back or damaged, they may not produce enough of these enzymes, so the food doesn't get broken down enough. And that's what you call a food intolerance. And often you'll experience bloating or a change in bowel movements. This is one of the first areas that we'll assess if there is intolerances or if there is what we call a food sensitivity. So a food sensitivity can happen when there's an immune response that happens in the gut. So you get what you call a release of white blood cells as a result of a food reaction in the gut lining. And this is often caused by what we call increased intestinal permeability, or otherwise known as leaky gut. So leaky gut is when these junctions along the gut lining slightly pull apart, and then you end up with these little tiny microscopic gaps where food particles can leak through into the bloodstream, and then that mounts an immune response against the food, because this sort of response shouldn't happen. There is pathology testing that we can do to assess the intestinal permeability. The way the test works is you drink this sugar syrup that should pass straight through the digestive system and out into the feces. So when you drink this sugar syrup, you collect your urine sample, and that will assess how much of that sugar syrup has leaked through into these gaps, into the bloodstream, and then into the urine. So essentially it'll give you a good indicator of your nutrient absorption as well. The other area that we will assess is the microbial balance. So the microbial balance is your level of bacteria in the gut. It's parasites, it's viruses and funguses and yeasts as well. So there's lots of parasites that we see quite frequently in the clinic. There's a fair bit of dysbiosis that we see around bacteria. So microbes have the potential to really influence our gut function in the way of, some of them will cause constipation and others will cause more loose bowels. Some live in the stomach, small intestines, large intestines. So they live in different areas in the body. So the way that we would assess those would be completely different. In some people, their symptoms are more in the lower gut, and that would be stool testing to assess where the imbalance is. For others, it's more their upper gut, and so that would be more breath testing to assess if there's a bacterial imbalance in the small intestines, or it's otherwise known as SIBO. Another area that we would assess is hormones. So hormones is not just your reproductive hormones, this is also referring to your stress hormones. So as mentioned before, the enzymes are released by these little hairs in the gut. When somebody undergoes high stress and a hormone called cortisol is released, cortisol actually causes blood to shunt away from the gut lining in response of a fight or flight response. So what happens in the autonomic nervous system is it's split into 2 sections. You've got the fight or flight response, and then you've got the rest and digest. And they're like a bit of a seesaw. When you undergo stress, the fight or flight response picks up, and then what will happen is the rest and digest reduces. And part of that response is that these enzymes get released less, which means that you're more likely to experience these gut reactions as a result of a stress hormone imbalance. The other is reproductive hormones. So reproductive hormones also have the potential to affect peristalsis, or the bowel movement action. They also have the ability to affect our nutrient absorption when they alter the gut flora, which is the microbial balance. The other area that we assess is nutrients. So these junctions along the gut lining, they're really important for keeping that gut integrity nice and strong. Lots of nutrients are needed to keep those cells nice and tight together. One of them being zinc, vitamin A, vitamin D is also really important as well. So we need to assess that the nutrient status of the person is strong to keep those gut lining cells nice and tight together. In the way of assessing what's happening in your digestive system, we offer thorough pathology testing as part of our 3-step methodology. If you've got food reactions along the digestive lining, then one of the first things that we would need to test for is your gut flora. So your gut flora is where all the bacterias live. So we'd need to assess what bacterias are living there. Then we could also look at what are the food intolerances, what are the food sensitivities. So we can do all of that through pathology testing. We would also assess any possible hormone imbalance and nutrient deficiency as well, and we're happy to work along with your doctor or gastroenterologist if needed. In the clinic, we offer 3 different stages of care to alleviate digestive symptoms. So the first stage of care is symptomatic care. So symptomatic care is not essentially addressing the root cause of the issue, but if you'd like symptoms like bloating and reflux to be suppressed fairly quickly, then we would look at different herbs, perhaps digestive enzymes, probiotics to work at supporting the symptomatic side of health. Then the next stage is corrective care. The stage where we really try and identify what the cause of the health problems are. By identifying the cause, we can then use nutrition, herbal medicine, and nutritional supplements and lifestyle changes to work at supporting the healing process. And then we go into wellness care. So wellness care is essentially when you've worked at alleviating the symptoms, you've addressed and treated the cause, and then the person is feeling a whole lot better. And you essentially at this point will have a total understanding of your digestive system, so you'll be able to use more food as medicine as opposed to using supplementation. So essentially this is the ultimate goal, but where naturopaths focus most of their time is on corrective care. So actually addressing the underlying issues so that you can then progress on to wellness care. So if you're ready to tackle your digestive issues, we recommend addressing these 5 primary health triggers, along with the implementation of our 3-step methodology and addressing these 3 stages of care. We look forward to helping you soon.